These magnificent creatures have been so much a part of our history, it's hard to imagine a time in this country without horses. Yet, prior to the arrival of Spanish explorers, the horse had actually been extinct in North America for thousands of years. Welcome to Your Family Animal Doctor. I'm your host, Sharon Williams. In previous programs, we've featured veterinarians who care for small companion animals, cats, dogs, birds, our family house pets. Today we're going to visit another group of dedicated veterinarians who work with large animals in the specialized field of equine medicine. Those veterinarians who care for America's horses. The ancient American horse stood only 18 inches high, and by the 16th century had been extinct for more than 8,000 years. It was the conquistadors who reintroduced a much larger horse to North America as they made their way into Mexico and what is now the southwest United States. The horse had been domesticated in Eurasia between 5,000 and 6,000 years ago. This dramatic event changed the course of world history. The ability to ride a horse gave man a new level of mobility, and for the next 4,000 years, the horse became the fastest, most efficient form of transportation and communication. The use of horses made the founding and expansion of civilization possible. Veterinary medicine has been practiced almost since man's first association with the horse. The Greeks became the recognized leaders and were employed by the Romans to care for their horses. The name veterinarius came into use for those practicing animal medicine, and veterinarium referred to a horse hospital. The modern horse is a large, complex, and much-loved animal. For thousands, the horse enjoys pet status and is ridden for pleasure at stables located in nearly every community. There are ponies, western horses, cutting horses, trotters, pacers, Tennessee walking horses, quarter horses, thoroughbred race horses, and the docile mare that your children ride at their grandfather's farm. All of these horses require medical care. Equine veterinarians are busy people. The growing horse population, combined with medical advancements and new technology, have made this an exciting and challenging profession. Today, we'll visit some of the outstanding medical facilities dedicated to equine health. First, we'll travel with Dr. Henry Vappel from the Kern Road Veterinary Clinic on a typical day as an equine veterinarian. He's been a veterinarian for more than 25 years, and it's obvious he enjoys his work. At his first stop, he performs an ultrasound on a pregnant horse.
Our first call, we did an ultrasound pregnancy exam at 45 days on a mare that we had bred. She's been checked in full at our routine way at 18 days and then again at 30, and the reason for checking them that often is to detect the pregnancies and to check for twins. And that usually after 45 days the mare will keep the pregnancy. That's when actual implantation in the uterus takes place.
This mare had a filly just a few months ago, so he'll examine the young one too.
And she will be going to a futurity, which is one of the major shows for the quarter horses, and so she'll need the Coggins test. We did that, and then we also gave her her second set of vaccinations.
An equine veterinarian must be trained in all areas of the horse's health. At the next stop, this beautiful horse gets a follow-up exam for an eye problem.
It was a recheck on a horse that had had a corneal ulcer. We checked it and stained the eye 5 days ago. We're rechecking it today. It looked really good.
While at the same barn, he was asked to check a horse that was showing lameness in one leg. His years of experience helped him know exactly where to start.
So we did a physical exam, palpating the legs, and then we saw the horse on a lunge line and watched her go in both directions, picked up a slight gait abnormality, and then we did what's called flexion tests, where you hold the leg up for 2 minutes and then trot them off if they have a problem. So we determined that she was slightly off-gated in the rear end. It appeared to be her hocks, and we're going to x-ray those hocks next, and depending on what we find on the x-rays, either inject them intra-articularly or go ahead with some of the hyaluronic acid products that are given intravenously.
Next, he visits a farm for racehorses. These horses are standard breds, trotting at harness raceways throughout the Midwest.
Standardbred horses race almost weekly. They're the horses that race on gait, either on the trot or on the pace. And because they train hard and race hard, they tend to need a fair amount of maintenance in the line of electrolytes, vitamins, many times articular injections for lameness. Because of the economics of the business, it's almost imperative to keep the horses racing if at all possible.
Veterinarians have to work with many other professionals to keep horses in top performance. This includes a farrier, or a person who shoes horses. Dr. Vappel clearly understands the importance of correctly shoeing each horse.
Farriers and veterinarians work closely together. Standardbred horses are probably shod once a month at least, sometimes more frequently, and it's incredibly important, the angle, the length of foot, because when they're going as fast as they can on a gait, just a slight angle change, just a slight deviation on the inside or outside of the foot makes a big difference of the way the horse's hoof comes off the ground and travels. Also, if they're not balanced, if the feet aren't properly balanced, there's lameness issues that come up because it puts extra pressure on tendons and ligaments.
After spending the day traveling with Dr. Vappel, we can see that being a veterinarian is hard work, but it offers many rewards.
But I've always loved veterinary medicine because I love the animals. The other thing is, when you're working with animals as a veterinarian, you're working with the people and the owners. And the compassion, the caring, the emotion is so vitally important. To work as a veterinarian, you have to have a passion for it, because most of it is incredibly great to do. You get just a wonderful feeling. The life and the lifestyle that veterinary medicine can afford you is wonderful. I think there are so many facets of veterinary medicine that people can work in that a person can certainly find a rewarding venue for veterinary medicine, regardless of what it is, private practice or universities, research, industry, the military. There are so many openings, but if a person must have the passion and must want to do it, and I would strongly encourage them.
Our next stop is at the Beetle Lake Large Animal Clinic, where we meet Dr. Robert Emery. His is a full-service large animal practice that focuses on equine performance. Because today's horses eat prepared grains and hay, their teeth can become very sharp and cause them pain. Dr. Emery is trained in equine dentistry and uses special tools to keep his patients' teeth in excellent health.
I'll generally sedate them relatively heavily because it's not a pleasant procedure to do to a horse. I like to look and I like to feel. Sometimes when I just do one or the other, I'll miss things. But I'll check each tooth and see if there's pain movement, if you're packing feed in any places, or if there's any problems. But then we'll basically go in there with the power float that I'll do. I'll do a lot of the big work with that rotary float. Then I'll spend a lot of time and put in a real nice bit seat on the front four teeth, which is not a natural thing, but when you have a bit in there, if there's any sharp points in those front four teeth, that'll cause performance problems. Check the incisors, make sure that the front teeth are short enough. And that's pretty much the procedure. It's still laborious to do it. It's still a lot of work.
When indicated, Dr. Emery uses manual therapy in combination with traditional Western medicine. He explains the treatment surrounding Irish, today's patient.
When Christy brought Irish in, first time that I saw it, I did the best lameness exam I could.
As we walk, a little bit higher on the right side of the hip as we walk.
The first thing we did was watch the symmetry of how we moved, and we did that on the parking lot. I watched stride length, and I watched how the pelvis moved. Didn't really do a lameness workup because we'd done that preceding. Brought them in the clinic, and I basically start in the front end. And the first thing I'll do is I'll usually put my hands up over the top of their head and just kind of relax myself as much as possible. Most horses, if I can get them to relax and bring their head down, they will let me do just about anything I need to. And then I'll move over to the withers. And the withers is the easiest part of the horse to feel spring. And basically, you work your fingers up and down those spinous processes, and you can feel if there's lack of motion or there is motion. As we move back in the pelvis area, the sacropelvic area is another really important area that I spend a lot of time on. One of the major joints, the most powerful joints, is the lumbosacral joint. That's where they say 60% of the power of the horse actually comes from. And I know that from pushing on these spinous processes that I can kind of level that back out, and sometimes you can really improve that power that the horse has, which is so important.
Dr. Emery also uses acupuncture on his patients. He explains his work on Irish with this type of treatment.
Manual therapy and acupuncture have been, I guess, increasingly accepted in the veterinary world. I think it's reasonable that anybody goes in with a fair amount of skepticism, because if you don't know what's going on, if you can't measure it, if you don't have scientific proof behind it, well, how do you know if this is quack medicine or if this is real medicine? And I think that people that go into it with a very objective view, that look at, one, you do the best job you can as a veterinarian first, and then use these as complementary care, I guess, not alternative, but complementary treatments. I think that you can probably get the best results out of that horse. And I spent my energy there trying to find deficiencies where the acupuncture points felt softer, I guess. And we seek out those areas and we basically put needles into them.
Shelley Steinbaugh is one of Dr. Emery's satisfied patient owners.
Sometimes the horses are stiff or they just aren't moving right, or when you're riding them you can tell that there's just something off or something wrong. His adjustments seem to make them move better, move freer, more relaxed. They don't seem to be as tight and tense. We're just real happy bringing him here.
We travel now to Michigan State University, where we are greeted by a matched pair of Andalusian geldings. Appropriately named Go Green and Go White, these beautiful horses have come to symbolize the university, and with it, the College of Veterinary Medicine and its state-of-the-art equine facilities. Dr. Edward Robinson, Department of Large Animal Clinical Science, explains the college's mission.
Well, the Veterinary Medical Center at Michigan State University has an equine clinic that accepts patients from around the state, and these are patients that need further diagnostic work and further treatment that most practicing veterinarians are unable to deliver. As part of our mission, though, we also educate veterinary students, and we try to create new knowledge about disease, so we have a research operation as well.
One important function of the college is to help horses with advanced or specialized needs. Horses are brought into the large animal clinic and carefully reviewed by the staff before the next steps are taken. This horse has swelling and pain in one of its front knees. Dr. Frank Nichols is the lead surgeon on the case, recommending arthroscopic surgery. His team prepares the horse thoroughly, from his mouth to his hooves, and then the horse is carefully anesthetized and taken into the operating room.
We performed an arthroscopic surgery on a horse that had a chronic knee problem. It was a mystery to the referring veterinarian because there were no radiographic changes visible ever, and the horse was presented here for a second opinion. And again, radiographs were negative, but the horse was very painful. It was painful on flexion of the knee. The knee was distended, and it was quite lame. So we suggested